has taken the stage at the White House, and we are going to listen in.
Outside of the country with the President of the United States. So on days today, I sometimes feel like Macaulay Culkin in Home Alone. I walk into the White House and it's very quiet and no one's there, and it takes me a second to realize exactly what's going on. But we've got a very big announcement today, actually a number of big announcements, and looking forward to hearing from Andrew and Dr. Oz and Kim about that. But let me just say that we've been hard at work over the last several months trying to make sure that we take care of the people's money and trying to make sure that the services that exist for the betterment of our fellow citizens, whether they're low-income kids who need access to food resources, whether they're low-income families who need access to medical benefits, that those programs are protected for the people who actually need them, that they don't exist to enrich fraudsters, but they exist for the American people for whom Congress has said they're entitled. And that's exactly what this fraud task force is about. One of the things that I thought going into it, but that I've learned about fraud, is that it always has two fundamental victims. The first victim is the American taxpayer, who is generously paid into these programs in an effort to give their fellow citizens a leg up. But it also has as its victims the people who are meant to benefit from these programs, who are not able to benefit, or maybe are benefiting less because of what a disaster some of the fraud has wrought in these programs. And let me just give you a few concrete examples of what we're worried about, of what we're targeting, and also what we're going to do to solve some of these problems. So first, we're announcing that the federal government is deferring $1.3 billion in Medicaid reimbursements from the state of California. And the simple reason is because the state of California has not taken fraud very seriously, and because of that, we see a lot of the consequences that I just referenced. And again, let me highlight the fact that this really is two separate victims. So there are California taxpayers and American taxpayers who are being defrauded because California isn't taking its program seriously. But also you have people who've been prescribed medications that they don't even need. Sometimes they've had drugs put into their bodies that they don't need because fraudsters have actually encouraged false prescriptions and false administration of medications. So think about this. You're just a person trying to go see a doctor. You assume that your doctor is doing the right thing, but these fraudulent healthcare providers are getting rich by giving people medications they don't even need. It's a defrauding of the American taxpayer, but it's a violation of the trust that should exist between every American and the people who prescribe the medications. That's one thing that we're targeting, and this is why we're taking this action, is because we want California to get serious about this fraud. The second thing I want to talk about, and it requires a little bit of background explanation, is that we are going to very aggressively encourage the states to take Medicare fraud more seriously. So I think a lot of you understand, but for those of you watching at home who don't appreciate this, the Medicaid system that exists in the United States is really 50 separate systems. The federal government pays most of the Medicaid money, but then each of the individual states actually administers the Medicaid program. Now, we have red states and blue states that go after fraud aggressively, but we also unfortunately have some states, mostly blue states unfortunately, that do not take Medicaid fraud very seriously. So you have what's called Medicaid Fraud Control Units, or MFCUs. These Medicaid fraud, these anti-fraud units within the Medicaid program, we generously, meaning the federal government generously gives these fraud control units many, many billions of dollars across the United States of America so that they can take Medicaid fraud seriously. But let me just give you an example to highlight how absurd some of these Medicaid fraud programs are, because they're not actually being used at all. This is a tool. This is a tool that we want the states to use, but unfortunately, a lot of states aren't using these tools at all. Let me highlight this with just a couple of separate statistics. So, the Hawaii Medicaid program has received billions and billions of dollars from the federal taxpayers. And of course, Hawaii taxpayers have paid in a lot of money into this program over the last years as well. Guess how many convictions or indictments has Hawaii had over the last few years in its Medicaid fraud program? The answer is 0. Not a single indictment, not a single conviction, because the administrators of the Hawaii program just don't take it seriously. They don't think that fraud is a big enough problem. They don't care about protecting resources, and they don't care about protecting that Medicaid program. So what does that mean? That means that if you're committing fraud in Medicaid in Hawaii, at least up until now, hopefully now they're going to take it seriously, you have had effectively free reign from the government of Hawaii to commit as much fraud as you want. That is a complete disgrace. In New York, which does a little bit better, but not by much, New York has had 9 indictments over the last year. 9 indictments. That's a $100 billion Medicaid program just in New York, and you've had 9 indictments. Indiana, which has about a third of the population of the state of New York, has had more than 4 times as many indictments over the same period. So does anybody here seriously think that the good people of Indiana are 12 times more likely to commit fraud than the people of New York? No, of course not. That's absurd. What is happening is that the leadership in New York are just not taking the fraud issue seriously. They're not using these anti-fraud control units to actually investigate and indict the fraud. So what are we going to do to fix that? Today, we are sending across 50 Medicaid programs, we are sending letters that will require them to show that they are effectively and aggressively prosecuting Medicaid fraud in their states. And if they do not aggressively prosecute Medicaid fraud, we are going to turn off the money that goes to these anti-fraud units. And I would say a couple things about this. You may think, obviously, this is a Republican administration. We're all proud Republicans up here. You may think that this is purely a red state or blue state issue. That's actually not true. We see Medicaid fraud issues in Ohio, the state that I used to represent in the United States Senate. We also see Medicaid fraud issues in a state like Maryland, which is obviously a very blue state. But both Ohio and Maryland have worked with us to take this issue seriously. They've worked with the guys behind me. They've worked with our entire team to make sure that they take fraud seriously. Again, this does not have to be a red state or a blue state issue. This is just basic good government. However, states like California, states like Hawaii, states like New York have completely not taken the fraud issue seriously in the Medicaid program. And so for those states that refuse to get serious about fraud, we are going to turn off that anti-fraud money. And if we continue to find problems, we can turn off other resources within their state Medicaid programs as well. Our goal here is not to do that. We don't want to turn off any money. What we want to do is ensure that people are taking fraud seriously. We want to protect Medicaid. We want to protect Medicare. But we can't do that if the states that are administering those programs are allowing those programs to be fleeced by fraudsters. So we encourage, whether it's California or New York or Maryland or Ohio, we encourage people to work with us. We want to help you use technology and other tools to get rid of the fraud, to get to the root of the fraud. We want to help you. But we can only help these state programs if those state programs are willing to help themselves. So these letters are the first step, the first effort to try to force these states to get serious about prosecuting fraud, and that's exactly what we're doing. Let me just talk about one final issue here. We see a lot of fraud in the home health care and in the hospice care system. I think Dr. Oz will probably talk a little bit more about that. But again, you have to appreciate that this fraud issue is fundamentally theft from the taxpayer, but also theft from people who need these programs. Just last month, a California psychotherapist, a woman who had spent 40 years treating patients, helping people deal with problems, found out that her Medicare program had been turned off, that she did not have access to the resources that she had been paying into for her entire life. Why? Because a fraudster had stolen her identity and signed her up for health care services that she didn't need, and so she had been turned off of the health care services that she did need. This happens way too much in the United States of America, and it happens because until recently, we did not have a government or an administration that actually took the fraud program and took anti-fraud prevention seriously. So let me just close with one final observation here. First of all, why are we doing this now? Why weren't we doing this 2 years ago? And the simple answer is because we didn't have a president and we didn't have an administration who took fraud seriously. So I want to thank the President of the United States, though I know he's busy in China. All of these efforts, all of these things that we're finding are because we have a president who has told us, take the fraud issue seriously, get to the root of it, and turn off the money when we find out that money is going to fraudsters. So that's exactly what we're doing. But I just want to say that for me, and I think for a lot of people who are involved in this effort, this is very personal, because I'm not just the Vice President of the United States. I come from a family, and I grew up in a family where we sometimes benefited from these programs. The generosity of the American people is one of the most amazing things about our country. I think all of us, of course, just passed tax day. None of us like paying our taxes, but we do it. And why do we do it? Because we know that it goes to give a bite to a low-income family that can't afford food. We know that it goes to pay the military who keep us safe. We know that it goes to some essential services. But that trust in our government, that trust in our institution, it depends on us taking that trust seriously. How long are people going to pay into programs if they know that money doesn't go to a low-income kid who needs health care, but that money goes into a fraudster getting rich? This doesn't work, and this doesn't make sense unless we take fraud seriously. So I'm proud to be part of an effort in our government. I'm proud to lead the effort in our government to finally take fraud seriously. We want to protect these programs for the kids and the families who need them. We want to ensure that the American taxpayer isn't getting fleeced. And I'd say just a few months into it, gentlemen, we have done a very, very good job. Let's keep it up. So let me turn it over now to Andrew Ferguson, who's the Executive Director of our Anti-Fraud Task Force. Andrew has done an amazing job, but I have to give a special shout out, not just because she's my fellow Ohioan, to Kim, who has probably found more fraud and has saved the American taxpayer more money than any single official within the government over the last 3 months. Kim, you have been an all-star. We're proud to have you on the team. Thank you, guys.